Alrighty. So before we get started, well, we're about to get started. So my name is Nadia. I'm with the Woodbridge Public Library. Thank you for attending tonight's Medicare Workshop. If you have any questions or concerns, feel free to direct them to me in the chat. My name is listed as WPL Librarian. And before we start, so we're gonna mute the mics and turn off the cameras so that we can all focus on the presentation. If you have any comments or questions as we go through the presentation, please just send them to the chat because then we're gonna just read them all off at the end. And also, if you enjoyed tonight's presentation, please remember to check out our upcoming events on our Facebook, Instagram, Twitter, or our website, woodbridgelibrary.org. And now, please join me in welcoming Medicare Supplement and Advantage Specialist, Michael Salum.
Nadia, thank you very much, and hello, folks. Thank you for making this your long drive out to this presentation. I'm going to be brief as I can, and I will do the answer as many questions as I possibly can. I do Medicare planning services. My name is Mike Salum. I'm a consultant and advisor, and I do speak Spanish. Please take my information down. If you have any questions or any concerns, you can email me, give me a call. I will say my services and consultations are free. I do not charge anything for my services or consultations. Now, come on, there we go. So who I am Medicare, like I said, I'm Medicare Planning Service. I was educated in the New York systems. I was in corporate America for 35 years. I was 27 of those years. I was a floor manager for a major Wall Street company. Bear Stearns was the company. I lost my job when everything happened back in 2008, although I did last till 2013. So I started doing Medicare just about a little over 4 years ago, about 4.5 years ago, and I really, really enjoyed it to the point where I realized that a lot of people don't realize, they don't understand Medicare. They don't understand the products of Medicare. And, you know, just by teaching, you know, and by just helping people out, you know, they can see that there's a lot more to Medicare, and it's really not that hard, not that difficult. A lot of whatever you see on TV, forget that. There's a lot, you know how TV commercials are. So, you know, you should really talk to a professional and get an insight on Medicare. And that's going to be my job today, is to educate everybody on Medicare. I do the educations. Like I said, I do free workshops, you know, and just to help people out. I can help them. I do provide the top companies in the United States, the Aetnas, the Cignas, Transamerica, the Bankers Fidelity, Horizon, the AARP. And I also assist with enrolling. I help enroll people in the Part A and the Part Bs, in Medigap plans, which is also known as a Medicare Supplement plan, Medicare Advantage plans, which is the only two avenues you can go when you get into Medicare, and the Part D, your RX plans. RX plans are very, very difficult to understand at times. So a lot of people do need a lot of help with that, and like I said, I'm here to help. Okay, I am not affiliated with any government agencies. I am my own broker. I am not affiliated with any individual companies either. Okay, so now we're going to cover Section 1 of Medicare. It's going to be Medicare and Medicare supplements and advantages. I'm going to do the Part 2, which is the dreaded Part D, the prescription drug plans, and that donut hole that you guys, I'm sure, are aware of. I'm gonna go through all that situation, and I'm gonna give you examples. That is very critical, the Part D. A lot of people don't understand it, and if you choose the wrong product or the wrong plan, it could cost you thousands, and I will be going over that. Okay, and then the Section 3 is going to be the top 5 mistakes that people make on Medicare. Okay, and I'll be going over that also as the presentation goes along. Okay, now let's get into the parts of Medicare. Hospital presentation, hospital insurance, the Part A of Medicare. Okay, that's your hospitalization. That's anything that's going to be doing with the hospital is going to be included in Part A. So inpatient, any skilled nursing facilities, let's say rehab, things like that, hospice, any certain home health cares, not all home health cares, certain home health cares is covered under the Part A's. Okay, Does Part A have a premium? It does not. Yes and no. If you've been working in the country and you've been for 40 quarters or 10 years, your Part A, if you paid your taxes and your Social Security taxes, your Part A will come free. Now, if you haven't met your criteria of the 40 quarters or the 10 years, you can purchase Part A individually. It's about $450, $460 a month. Okay. But again, those people that have been working into it, paid into it, it's for free. Okay. Now we go to the Part B of Medicare. The Part B of Medicare is anything outside of the hospital. Just like I said, the Part A is inside the hospital. The Part B is outside of the hospital. Any doctor visits that you would go to, any outpatient care, whether it's Ready clinics or whatever it is, all of that will be covered under your Part A. Durable medical equipment, for instance, anything for insulin, maybe wheelchairs, all that type of stuff, that will be covered under the Part B. Preventive services, wellness products and things like that is covered under the Part B. Okay. Now, the Part B, there is a monthly fee for it. The lowest amount is $144.60. Okay, it's income adjusted, and I'll show you in a few minutes. I will show you how that works, the income adjustment on it, what's called the IRMA. So, the Part B of Medicare, it's like I said, it's usually about $144.60. That's the lowest amount, but we'll go over that also. I'm going to skip Part C and I'm going to go over to Part D because A, B, and D basically work together. Part D is the prescription drug plan coverage. Okay, it's run by individual insurance companies, privatized insurance companies. Although they do have to maintain the same criteria throughout every single plan that they offer, and it has to be through federal, state, and CMS programming that they have to meet those criteria. Okay. Those are also income adjusted, and it works directly with the Part B adjustment. And again, I'll show you that also. Now, the Part C of Medicare, I left that out because it's a bit of a misnomer. It's not really a part of Medicare, but it's the Medicare Advantage portion. Now, the reason I left it out is because Medicare Advantage actually takes over Part A and Part B, and most of the times it takes over for Part D also. So a lot of the Medicare Advantage plans do have the prescription drug coverage already included. Okay, it's a privatized plan. It's run by individual insurance companies. Most of them have a network that you would have to be involved in if it's an HMO or a PPO, and that's exactly what it is, an HMO or a PPO. So those, if you're under a Medicare Advantage, then those plans you would have to be within that network and such. Whereas with Part A and Part B, or Original Medicare as it's called, with Original Medicare, you can go to any doctor, any hospital in the United States that you like. 98% of the hospitals in the United States take Original Medicare, and about 95% of the doctors take Original Medicare. The ones that don't are the nip and tuck guys. That's not covered by Medicare. So sorry, guys. If you need a nip and a tuck here and there, that's not going to happen with Medicare. So anyway, let's go on to next. Now, as I had mentioned before, the Part B monthly premiums. And let me just go back real quick. Your Part B payments, if you are collecting your Social Security income, your Part B payments will be automatically deducted from your monthly premium. If you have not chosen, you're on Medicare and you have not chosen to take your Social Security income or your Social Security benefits, then you will be billed quarterly by Medicare. So you can get Part A or you can get your Part B, but not have your Social Security benefits. Okay, again, you'll be billed quarterly. So the way the income structure works, now this is for 2020, the 2021 figures have not come out yet. They normally come out about late this month or early, most in November. But let's say as you can see the tiers there, tier 1, if you were filing individual your tax return and you earned under $87,000, your premium will be the $144.60 that I have mentioned. If you're a joint filer and both you and your spouse's income is under $174,000, it'll also be $144.60. And as you can see, tier 2, $87,001 to $109,000 filing individual, or 174,001 to up to 218,000, then that monthly premium goes to $202.40. So that's what you will be paying for your Part B. Okay. And as you can see, Tier 3, 109.1 to 136,000, 218.1 to 272,000. You'll be paying $289.20 of your Part B premium. And as you can see, down to Tier 6, over $500,000, or filing together over 750,000, over $750,000, you'll be paying almost $500 for that Part B premium. Okay. So as I mentioned, the Part D also has the income adjustment. It's called IRMA, which is the income related monthly adjustment amounts. Now, let me just backtrack a quick second. I should have mentioned that this is the way they look at your income. It's the MAGI, or the Modified Adjusted Gross Income. Okay. There's the adjusted gross income. Now, don't ask me, please, about that. I'm not a CPA or anything like that. I don't do taxes, and I can't stand math. So the MAGI, or the monthly adjusted gross, or the adjusted gross income, has certain deductions that are taken out, and then that'll tell what your income is for the year. The MAGI is modified, so there's certain incomes that are put back into that equation. Okay, and then that becomes the MAGI, and that's where they'll determine what your monthly premium would be. Okay. As you can see here, this is the MAGI for your Part D. Now, there are premiums this year. It's a plan premium, whatever the insurance company or the carrier of that Part D plan wants to charge. There are plans like a Silver Script plan for $7.30. There are plans like one of the Horizon plans that you're looking at over $100, $120, $130 a month on those plans. So again, if you notice the income earnings, so it'll be whatever your plan premium is plus $12.20 or $31.50, and you can see that's the same formula, okay, for those plans. Again, now if you look at the Tier 6, over $500,000, over $750,000, you're looking at whatever the plan premium is plus $76.40. Okay. There's one thing I want to mention. This is very, very important. You guys have been working, and now you decide to retire. So let's say you were earning $200,000 a year. And by the way, whatever they're going to charge you for your Part B premium goes back 2 years. Okay. So 2019 hasn't been set up yet by the government. 2020, obviously. So 2020, let's go to 2021. 2020 has not been set up. 2019 will be set up for the 21 period. So they're going to go by whatever your earning was on 2019. Okay. Now, very important. When you retire and you're not making as much money as you were earning when you were working, okay, you're going to get a letter in November. You're going to get a letter from Medicare. Medicare is going to tell you your Part B premium due to your 2019 filing is going to be, let's say, 31. Let me backtrack a second. It's going to be $289.20. Okay. You have a 60-day window, okay, that you can contest that and tell them, listen, that was when I was working. My projected income for 2021 is going to be only, let's say, $150,000. So that's going to put you into the Tier 1 level, which will be the $144.60 or whatever it's going to be next year. But it'll put you to the Tier 1 level. They will give you the benefit of the doubt, but they will check it. Trust me, they will check it. For the coming year, as long as you made that amount, you'll be fine. If you made over it, they're going to charge you. Okay, so keep that in mind. You retire, you're not going to make as much money as you were earning. So instead of having to pay a Tier 3 Part B deductible, Part B payment, you can get away with a Tier 1 as long as you're going to be earning less. Okay, so keep that in mind, and remember, you have a 60-day window in order to talk to them about that situation once you get that letter. Okay, folks. So let's go into what the initial enrollment period is. Okay, and this is the #1 mistake that people make. You have a 7-month window when you become eligible for Medicare. Now, you become eligible for Medicare on your birth month when you turn 65. Okay. If, for instance, your birth month is September 10th, as the example shows, that's your date of birth, September 10th, you can enroll in your 7-month window is 3 months prior to September, the month of September, and 3 months after the month of September. Okay, so you can start enrolling in Medicare from June 1st all the way up to December 31st. All right. Some people do not forget about enrolling in Medicare and don't do it, and then all of a sudden when they come in and they haven't had credible coverage, and I will go over what credible coverage is, they haven't had credible coverage, and now now you're enrolling late. So what happens? You can incur a 10% penalty for every year that you have enrolled late in Medicare. And that 10% penalty is not on a yearly basis. It's forever. That penalty is going to stay with you forever. And also, if you enroll in your RX plan late, that is 1% for every month that you enroll late after 63 days of not having credible coverage in an RX plan. So every single month it's 1% penalty. So remember, it's very important to know when you need to enroll in what plans. Okay. If you were to stop working, let's say you've worked past your initial enrollment or past 65 and you have credible coverage, you're good. If you choose to wait and not enroll, you have an 8-month window in order to enroll. Okay. One of the other situations that people see and don't realize, and because nobody really tells anybody, but one of the things that happens is once you're past that 8 month, and let's say you go in on April 1st or April 2nd, you go into Medicare and say, okay, hey, listen, I want to enroll in my Part B. And they turn around and say, well, you can't enroll in Part B because what happens is after your 8th month, you have a window between January 1st and March 31st in order to enroll. So they're going to tell you, it's April, sorry, you got to come back in January 1st. So now you come back January 1st, and then they enroll you. And what happens? Your Part B does not become eligible until July 1st. It's very critical. So now what's going on? You're going through over a month and what's that? A year and like 6 or 7 months with no coverage whatsoever. All right. So you have to be very, very careful with this stuff. Okay. Again, you guys can always call me. Whatever the situation is, I can walk you through it and let you know. All right, so the initial enrollment period is very critical. Another thing I want to mention about the initial enrollment period, if you submit between June 1st and August 31st, you will get your Part B to be for eligibility on September 1st. Okay, but if you submit on your birth month for your Part B, you're going to have to wait. It's going to come for the following month, so you're looking at an October 1st eligibility. Okay. And every month after that you would submit, let's say September, now you submit in October, now you got to wait October plus 2 more months. If you submit in November, now you got to wait November plus 3 more months. And then if you go into December, you got to do December plus 4 more months on top of that. So literally, if you pass in December, if you submit in December, even though you're in your initial enrollment period, you're not going to have coverage for at least probably till around March. Okay, so that's the number one mistake that people make, is not knowing when to enroll and how to enroll in original Medicare. Remember, you will be eligible on your birth month at the age of 65. Okay. Remember, any questions, please hold them to the end, and I will be more than happy to answer them. Now, there's several situations where you do not need to enroll in Medicare. Okay. And I'm going to go through both, where you need to enroll and where you don't need to enroll. So now, let's say you reach the age of 65 and you're in a group, you're currently in a group plan or your spouse's group plan, but your employer has less than 20 employees where you're currently working. You have to get Medicare. Medicare becomes primary. Okay. So Medicare becomes primary, you have to get Medicare, and then whatever plan is afterwards, maybe whatever it is, okay? But you do need to become, again, Medicare if your employer is under 20. If you hit eligibility at 65 and now your employer is over 20 employees, or your spouse's employer is over 20 employees, you can keep that group health plan. Okay, so that will be credible coverage for you, and you do not need to get Medicare, and you do not need to get that Part B. And it's critical not to get the Part B, and I'll explain why later. So it's critical not to get A and B if you're going to have a group health plan and you're over 20 employees, if you don't want to get Medicare. There are situations when you might want to look at, even if you're, you might want to look to see what your group health plan that you have, what is it covering, as opposed to what you can get with Medicare. There's a lot. Medicare is a very good product. They give you a lot for not much money. Okay, so if you have a high deductible or high co-pays, things like that, it might be worth it might be worth a look and see what you can get for what kind of coverage you can get. In other words, evaluate both plans or both coverages and see what you can get. Now, going back to what's covered. If you're on disability prior to 65 and your employer has, or your spouse's employer has under 100 or under employees, then Medicare again becomes primary. And as you can see, if the employer has over 100 employees, you can keep that group health plan. That's fine. If you're an employer if you're on a retirement plan, you're entitled to Medicare. Medicare comes first. Okay, and this one, the last one, is covered by COBRA. Most people, they retire and they know that COBRA, you can get an 18-month extension on that COBRA plan. So our mindset prior to the age 65 is, well, COBRA is exactly the same coverage that you would have that you had in your company previously. Well, it's not at age 65. Okay, so keep that in mind. It's called the COBRA trap. A lot of people don't understand this or don't know about it. And what happens? Medicare becomes primary when you are Medicare eligible. So if you're on COBRA, Medicare is primary. If you don't have your A and your B, and you go into a hospital thinking, nah, I have my COBRA coverage, you're going to submit the bill, or the hospital is going to submit the bill to COBRA, and COBRA is going to say, no, that's got to be sent back to Medicare first. Well, guess what? You're going to be stuck with that bill. Okay, so it's very critical. It's called, like I said, it's called the COBRA trap. Medicare is primary if you're going to keep it. But in all honesty, COBRA is so expensive, it's not even worth taking it. Okay, you're better off going on Medicare and its supplement products. All right, folks? Now, the Part B enrollment scenarios that you're going to come across, okay? If you're about to turn 65 and you are collecting your Social Security income, you will be automatically enrolled in Parts A and B. Automatically, you're collecting Social Security, you're going to be automatically enrolled A and B. Okay, it's critical at this point if you want to continue your groups, your group coverage through your company, to disenroll from B. It's very critical to disenroll from B, and the reason why is that once you leave that company and you leave that group coverage, if you are already in your Part B, you have a 6-month window on that Part B to pick up any plan you want. If there's an issue and you coming in with your Part B, after 6 months you have to go through medical underwriting, and if for whatever reason you might be sick or what, God forbid, whatever it is, you might not be able to get a plan. And you can get a Medicare Advantage plan, but the Medicare Advantage plan, you would have to wait until the annual enrollment period, which we're in right now, between October 15th and December 7th. And that'll be a January 1st when it takes effect. Okay? So it's very critical. If you're enrolled in Social Security, you're turning 65, you're auto-enrolled, you're on Social Security, you're going to be automatically enrolled in A and B. You need to disenroll from that B portion. A doesn't matter. You still can use your coverage. It doesn't matter. I have disenrollment forms, or you can pick it up online. Just type it in, disenrollment for Part B, and it'll automatically come up. I have it. I can email it to you, whatever it is. Okay. Now, if you're turning 65 and you're not enrolled in Social Security, and you want to get your Part A and your Part B, you can go right on that website that's there, the secure.ssa.gov, I claim RIB, and you can do that automatically. It'll take a few minutes. It takes about 15 minutes, and you'll have your ID cards. If you do it soon enough, you'll have your ID cards when the eligibility starts. Okay. If you are continuing to work and you have good group health coverage and you don't need to change it for any reason, and you're continuing to work past the age of 65, and one of the scenarios works that you can keep that group coverage and it is your credible coverage. When you do disenroll from that, when you do decide to retire, you're going to need the CMS forms. Okay, so this is after age 65 and you continue to work. Now you're going to retire. The CMS forms, which look like this. Remember that 10% penalty I told you guys about a little while ago? Well, this is going to avoid you getting that 10% penalty. Okay, because these two forms right here is going to let Medicare know, or Social Security know, that one, you had credible coverage from when you were Medicare eligible, and the one section, the one on your left, that portion is filled out by yourself. The form on the left, the form on the right, it's the L564E. That one is going to be, that's your proof of coverage. That's the one that's filled out by the HR department. So now if you were to go in and, okay. So now if you were to go into your HR department, now let's say you want to retire, you're going to retire September 1st. Okay. You should start working on this 3 months prior to when you're looking to retire. Okay. And what happens is this way you can have all your ID cards, everything will be set up for you. You can have whatever supplement or advantage plan you want. Okay. So let's say you're going to go, we're retiring August 31st and you want your Part B to begin on September 1st. The HR department is going to fill out that form. I'm not sure if you can see it, but on line 5, it's going to say from when you've had credible coverage up until the day you're going to stop, you're going to continue having credible coverage, and then what day that credible coverage is going to end. Okay. So if you want to retire August 31st and you want that Part B to begin September 1st, they're going to put down that your August, it was the last time you're going to have coverage. All right. Medicare will automatically take care of all that, and you won't have any issues. You will not be penalized or anything like that. You can go up on the, if you want to retire and you're going to go August 31st and submit your paperwork, you can do that. You're not going to get the ID cards or anything else, but you can do it, and you will get coverage for September 1st. Okay. Now, with these forms, they say you can mail it in, okay, to Social Security. I say one thing, two critical things here. One, I'd rather not use the mail system. I'd rather drop it off to them. And two, take copies. Make copies of these forms. I have seen countless times husband and wives going into Medicare when they're finally going to retire. They're going to, the spouse's coverage is ending. The two of them are going to go in looking for their their Medicare, their original Medicare. And 2 or 3 weeks later, one of them gets the ID card, the other one gets nothing. They call up and say, oh no, we never got anything, but yet both forms were submitted at the same exact time. Okay, so it happens a lot. Take paperwork on that, make copies and hold on to them. Okay, God, hopefully it won't happen, but you never know. All right, folks. Again, this is going to be the 10% penalty. This is going to minimize it. You're not going to get the 10% penalty submitting the CMS forms. All right. By the way, I have those forms also. I can email them to you. Now, you get into Medicare. It's not difficult. You either have to go, you get to a fork on the road to get to Medicare. You either go left or right, okay? So if you get original Medicare, you're going to have to get Parts A and Parts B. You're going to have to get Part D. Normally that covers about 80%, and I'll be going over the figures in a few. So that normally covers about 80% of coverage. In order to close that gap, the 80% to whatever the doctor is going to charge or the hospital is going to charge, you need what's called Medigap insurance or Medicare Supplement insurance. Okay, it's fairly inexpensive. It could run about at age 65, male and female, about $130 a month. But it covers everything. If you get the Plan G, if you're newly eligible for now for 2020, you can only get the Plan G. The only other out-of-pocket expense that you would incur with your original Medicare and a Part D is for 2020 is $198 deductible. After that, any Medicare approved amounts or any Medicare approved procedures is absolutely free. Okay, so you will be paying for your Part B, you'll be paying for a Part D plan, and you'll be paying for a Medicare supplement plan. But all in all, you're probably looking at just under $300 for everything. Okay, it's a great plan. You can go to all the hospitals that take Medicare. Like I said, 98%. All the doctors that take Medicare, like I said, 95%. So with original Medicare, you can go anywhere in the country to any hospital you want as long as they take Medicare. Okay. Now you can also go through that Part C that we discussed earlier, the Medicare Advantage plan, which is an HMO or a PPO. And remember, I said that this plan is it's sold separately, okay, and it takes the place of original Medicare A, B, and D. For the most part, usually D. So with that, what it does is you are under the umbrella of a certain company. It could be United Healthcare, could be Aetna, could be Cigna, could be Horizon, whichever plan it is. A lot of these plans are sold for locally within, not many in the county. Most of them, a lot of them are all for statewide. So they do cover, they do take care of certain doctors within the state, whichever doctor wants to sign up with that particular company, with certain hospitals within the state, and so mostly it's within the state. Now, if you go outside of the coverage area, you are covered for an emergency room visit. So if anything happens, you can't get an emergency room. If it's anything critical, they'll stabilize you and then get you back to your coverage zone. All right. So it's not like they're going to leave you high and dry. You can't get, you will be okay. There's a lot, unfortunately, there's a lot of hospitals, like the major hospitals don't take Medicare Advantages. For instance, like a Sloan Kettering, John Hopkins, a hospital for special surgery. If it's an HMO, they don't take it. They do take PPOs. They will accept a PPO. Generally, PPOs do have a higher deductible rate, okay? Last year, the deductible rate for an Advantage was $6,700. So that's the maximum out-of-pocket expense that you would incur. This year it's up to, I think it's $7,150 or $7,450. I can't remember off the top of my head. It just happened recently. So it's a little over $7,000 that your Part B deductible can come in. I'm sorry, your Medicare Advantage maximum out of pocket is. The PPO could be as much as $10,000. It's a little more now for 2021. So you can incur more charges with a Medicare Advantage plan. Just about everything that they do has, let's say, if you instance for an X-ray, CAT scans, MRIs, you will incur deductibles like that. If you want to stay within the network, a lot of times they don't charge. You're not part of that deductible, so you can be okay with that. A lot of the Advantage plans do cover dental and vision, okay, and they do give you some over-the-counter expense cards, okay. I've seen $30 a month. I've seen a couple of $100, not a month, every quarter. I've seen a couple of $100 a quarter. Okay, I've seen as much as $750 for, let's say, dental and vision, to as little as maybe $100 a year for dental and vision. So they do carry those plans. They do carry those, although they are limited. If you decide to move, if you have a Medicare Advantage plan in your zone, in your area, let's say you decide to move out of state, you do need to pick up another plan at that point. Okay, and you do have a safeguard as to when you can enroll for another Medicare Advantage plan at that point. Okay, and I'll be getting into those in a second or two. Okay, so that's the difference between original Medicare and a Medicare Advantage plan. Okay, again, one of them has the monthly premium. It's $130. What I personally like about the original Medicare with a Medicare supplement plan is, if it's $130, you're looking at, let's say, roughly $1,500 a year plus the $198 deductible. So you're looking at, let's say, $1,600, $1,700 a year, but that's the most you're going to spend out of pocket for any kind of hospitalization or anything. Okay. Plus, I like the fact that I can go anywhere I want, whenever I want, in order to, for coverage. Okay. That's my personal opinion. Everybody has, however they want to do it. A lot of the Medicare Advantage plans, it's zero premiums. You don't pay anything for them on a monthly basis. Okay. So that's a good advantage that the Advantages have. All right. So again, I'll be answering questions, later on in the presentation. Okay. So the characteristics of the comparison between original Medicare with a Medigap plan versus an Advantage plan. This is the number 3 mistake that people make, is not really analyzing what the coverages are. Okay. And I didn't skip over 2. 2 is going to be the RX plan. So, if you guys go, what happened to 2? No, I didn't skip over 2. This is something, and I really urge people to really look at what you're getting when you're originally going to pick up Medicare, because this could be something that, it's going to be critical for you and could possibly be for the rest of your life. Okay. Whereas an Advantage plan, you can enroll during the, every single year during the annual enrollment period. But with a Medicare supplement plan, you have, once your Part B becomes effective, you have a 6-month window in order to pick up any plan you want with no questions asked. I had a gentleman picked up a plan, and he had liver cancer, and thank the Lord I was able to get him a plan, so he was fully covered with all of his needs. But if he would have waited past that 6-month period, he would have never been able to pick up a Medicare supplement plan. And he lasted for 1.5 years, and everything was paid for. He had no, other than that premium and the deductible, everything was paid for. So it's, like I said, it's very critical that you pick the right plan for you, because we don't know what tomorrow's going to bring. So now, difference between Medicare Advantage and original Medicare with a supplement plan, the relationships to Medicare Parts A and B. The Advantage replaces it, becomes a Part C. Original Medicare and a Medicare supplement, the supplement plan supplements, as the word says, original Medicare. Okay. Is there a private network required? For most Advantage plans, yes, there is. No, there isn't for a Medicare supplement plan. Are referrals required on some plans with an Advantage plan? Yes, it is. It is not for a Medicare supplement. You can go to any hospital, any doctor you want at any time. Part D is included in most of the plans, or with the Part C or the Advantage products. It is not included on a Medicare supplement plan with original Medicare, so you do have to get that separately. So it's gonna be an added cost for there. Monthly premiums, they do vary with the Medicare Advantage. Usually the PPOs are the ones that charge a bit of a monthly premium. They are lower, although I have seen some PPOs that are like, why are we charging this much? But I generally tell people you don't need to spend that much money, on a PPO. So I'll go over the best plan and then make up your mind from there. But anyway, the Medicare supplement plans, they do vary. They're generally a little bit higher. Like I said, at age 65, male and female, it's roughly about $130 a month. There's some companies that offer household discounts, so you can get anywhere 7 to 10% off on the plans if both husband and wife go with the same company. So they do give, they do give you a little bit of a break. They do generally go up anywhere from 2 to 4 to 5% on a yearly basis. The Medicare supplement plans, and it's like half for age. So like, let's say it's 4%, 2% is for aging, and 2% is for hospital, medications and hospital cost increases. Okay, but again, it's still a good product. Okay, now is it guaranteed? Oh, I'm sorry. The annual out-of-pocket costs. This is an outdated $6,700, but again, it's over $7,000 for 2021. And again, with original Medicare and a Medicare supplement, the Plan G is only $198. That's it. So you go to the doctor, and that, by the way, has nothing to do with the hospitalization. That only has to do with the Part B. Okay, which is the doctor. So the first day you go to the doctor in January, or it's testing or whatever it is, you will be charged that $198. After that, everything that you do is free. Okay, is it guaranteed renewable for life? A Medicare Advantage? No, you have to check the plans out every single year. Now, October 15th to December 7th, annual enrollment, and you do have to see if and plans can dissolve from a plan, even if you haven't moved, they can dissolve from a certain area. So you would have to pick up a plan at that point. Okay. Original Medicare, you do have safeguards for the most part. It's always renewable for life. It's always guaranteed renewable. The only way for you to lose a Medicare supplement plan is if you don't make a payment. That's the only way you lose a Medicare supplement plan. All right, folks? So now let's go into the Medicare supplement products. All right, the top 3 plans on the market is the Plan F, Plan G, and Plan N, okay? If you are newly eligible to Medicare, so you turn 65 January 1st or later of this year, 2020, you can no longer get a Plan F, okay? Anybody that had turned age 65 prior to January 1st of 2020, you can still get a Plan F or a supplemental plan, or high deductible Plan F. So you can get a Plan F if you were 65 prior to January 1st of this year, okay? But as you can see there, back in 2017, we only sold 7% of our plans were Plan Fs, okay? 77% of our plans were Gs, and then 8% of our plans were the N plan, okay? And I'm going to go over the plans and I'm going to explain to you why. And it basically has to do with what's covered and what the premiums are, okay? So let's look at a Plan F, okay? Plan F Part A, let's start with that. Now, mind you, Plan F, whether it's a Plan F, a Plan G, or a Plan N, the Part A of original Medicare is exactly the same. So this formula that you see here is exactly the same formula for plans F, G, and N, okay? So let's say you spend 1 day, you spend 60 days in the hospital, you only have original Medicare, you do not have a Medicare supplement plan, you're going to wind up walking away and you're going to have a $1,408 bill, okay? If you are unfortunate enough to be in the hospital for 61 days to 90 days, which is the most that Medicare gives you, you will be spending the $1,408 plus $352 a day between day 61 and day 90. If you're past 91 or the 90 days and into 91 days, they do give you 60 lifetime reserve days. So it's only 60 days lifetime is what you're going to get. So let's say that's up to 150 days. So from day 91 to day 150, $704 comes out of your pocket on a daily basis. Okay, so if you're there for 150 days, you're paying $1,408, you're paying $352 for 20 days, and you're going to pay $704 for 50 days. It's quite a bit of money, okay? If you look at the green section, now if you look at what the plan, if you were to get a Medicare supplement plan, the plan pays all of that, the $1,408, the $352 a day, the $704 a day. So you don't pay anything for it, okay? Obviously, you can see it on the green section there. That's all you pay absolutely nothing. Now, if you're under the services, if you look and see, it says, now remember, Medicare pays 90 days, and then they give you that 60 lifetime reserve. Well, with a Medicare supplement plan, they actually give you an additional 365 days of Medicare approved procedures. Okay, so you can in essence get 515 days of coverage in a hospital, where you're not going to pay for anything. Okay, after the 515 days, then you beat. At that point in time, it's like, oh well. Okay. Now, if we go into skilled nursing facility care, which is any kind of rehabilitation after you get out of the hospital, the first 20 days is covered by Medicare 100%. But from day 21 to day 100, Medicare will cover everything except for $176 on a daily basis. The Medicare supplement plan will pay the $176, so you will incur no costs up to 100 days. After 101 days and thereafter, then all costs will belong to you. The first 3 pints of blood are not, for whatever reason, is not covered by Medicare. So, but the plan will cover the first 3 pints of blood, so you don't have to worry about that. Any additional amounts is covered by Medicare 100%, so you don't have to worry about that. All hospice care is also covered by Medicare and a Medicare supplement plan. The co-payments will also be covered by the supplement plan, so you basically are not paying anything on the hospice with your Medicare A, B, and a supplement, okay? So basically, your Part A at any time you go into a hospital, you are not going to pay anything. Okay. If you had a Medicare Advantage plan, you're going to pay about that $1,408 because some Medicare Advantage plans, I've seen them go for where they'll charge you $250, maybe $350, depending on the plan itself, for the first, 3 days, 4 or 5 days, 6 days, whatever it is. And if you do the math, it literally equates to about the $1,408. Okay. And with a Medicare Advantage, every time you go into the hospital, if it's within the first 3 months and you go in for it's the same issue, then you don't repay anything. But if it's past 3 months or another issue at that point, then you're going to be subject to that deductible all over again, up to, remember, that $7,000 deductible. Okay, so that's your Part A, and remember, it's the F, G, or the N, exactly the same plan. There's no difference. Okay. The Part B is where we get the differences, and we get the differences in pricing. Okay. Remember, insurance, the more you pay, or the better insurance you get, the more you're going to pay for it. Okay. Plan F is an awesome plan. You will be 100% covered for everything, but you're going to pay for it. Okay. So now the Medicare under the Part B has $198 deductible, and it generally, any Medicare approved amounts. Now remember, Part B is the doctor portion. Medicare will only pay 80% of whatever bill the doctor sends in. Okay. Generally, the 20% comes out of your pocket. The first 3 pints of blood will be included, so you're not worried about that. There's also what's called it's on this page over here. It's the, oh my God. Excess charges, excuse me, I'm sorry, it slipped my mind. Excess charges. What excess charges is, okay? Excess charges is that if there's a Medicare, Part B excess charge, there it is, I'm sorry. It's covered under the Part F, but with excess charges is, if Medicare approves, if a doctor charges an amount, let's say $250, that $250 goes, is billed to Medicare. Medicare comes back and says, sorry, we're only paying you $200, okay? Well, with the Part B excess charges, 15% of that bill can be passed on to you, okay? But you don't have to worry about that with the Plan F. If whatever excess charge it is, and the doctor incurs that bill to you, the Plan F will cover it, all right? So you don't have to worry about that. All testing, all diagnostic testing, CAT scans, whatever it is 100% covered with the Plan F. The Plan F also has, actually all the plans have exactly the same, whether it's a Plan F, G, or the N. You have foreign travel. Foreign travel is not covered by Medicare. Foreign travel, the Medicare Supplement plan does pay, that gives you a $50,000 lifetime allotment benefit. That benefit goes a long way outside the U.S., okay? You will have to pay a $250 deductible, and then you will incur 20% of whatever charges happens overseas. Now, this is for an emergency. If you're on vacation, you break a leg, you break an arm, or something. If it's an emergency, that's when you're covered. If you're overseas and you're on vacation and you get the sniffles or a cold or anything like that, that's not covered. It has to be an emergency, okay? And that's a 60-day period in order when you're overseas. After 60 days, then you're not going to be covered. They're going to consider you're living there at that point, okay? So you do have outside of the United States coverage with a Medicare supplement, not Medicare, but a supplement plan. Okay. Now, to give you the Plan G difference, as I have mentioned, the only difference between a Plan F and a Plan G is that with the Plan G, you must pay that $198 deductible. All right. So that's going to come out of your pocket, as I have mentioned before. But once that deductible is met, it's going to be a Plan F again because everything's covered. Okay. Now, why did we sell, since Plan F is such a great product, why did we sell, sorry about that, why did I sell 77% of my policies were Plan Gs and not Plan Fs? Because the premium for a Plan F could be as much as $400, $500, $600 more than a Plan G. So we always recommend, why do you want to pay so much higher when, if you're going to, let's say you're going to spend $500, and it gets more as it ages, Why are you going to spend $500? Give an insurance company $500 more than you really need to, when with a plan G, you can save $500 and all you need to do is just pay $300, the $198 deductible, and that's it. After that, it's gravy. So you see what I'm saying? You're saving money with a plan G. Okay. Now with a plan N, and by the way, the foreign travel, as I mentioned, is exactly the same. There's no difference. The plan N, the difference with between a plan G and a plan N is you still have the same $198 deductible. All right. You still have that Part B deductible, but now the plan N adds copays. So it's $20. It's no more than $20. It's up to $20 for office visits, doctors, and specialists. Okay, and no more than $50 for an emergency room visit. So it is less expensive to plan N, but you get less coverage. And remember that Part B excess charge, that 15%. Okay, that's not covered under the plan N. You could be liable for that under the plan N. Okay, and the difference between the pricing and the plan N is like maybe $20 to $30 a month in difference, depending on which insurance company. I've seen more, and I've seen, no more, no less, but I've definitely seen more. So a lot of people say, you know what, in order to avoid like the Part B or anything or copays like that, I'd rather just spend another $30 a month and not worry about it. Okay, so that's the difference between with the pricing on the plans. And that's basically it as far as the supplement plans go. Let's see. Now, let's get into the Medigap open enrollment periods. Okay. You remember, you have that. I told you, once your Part B becomes effective, you have a 6-month open enrollment where you can get any plan at any time with any insurer that you would like. Okay. Now, Medigap plans are federal and state regulated programs and CMS regulated programs. Okay. So every single Medigap plan, now people, you keep this in mind. A Medigap plan is not primary, no matter which insurance company you choose, whether it's Aetna, United Healthcare, Cigna, whoever. They all have to be exactly the same. They all have to. Medicare is primary. Whatever Medicare says you have to pay, that Medigap policy has to pay the balance, as long as it's a Medicare approved amount. Okay. So I hate to say this, but it's true. It all depends on when you're It all depends on the payment, the pricing on it, right? What I hate to say is, let's say you're going, it's like getting gasoline. All right, you're going to get gasoline. So you can go to 5 different gas stations, and it's going to be 5 different prices for regular unleaded. It's the same as a plan. Let's say a plan G. Let's go with a plan G. You can go to 5 different insurance companies and get 5 different pricing for a plan G. If it's going to react exactly the same, why do you want to spend more? So my thought is always get the A-rated company, the best A-rated company with the least expensive pricing. Okay. Bottom line. All right. Now back to open enrollment. If you were disabled, now you had your Parts A and your Parts B prior to age 65. So at that point in time, now remember, when you are on disability, once you become disabled, you have to wait 24 months, 2 years, in order to pick up Medicare Parts A and B. Okay. Once you do that, you do have a 6-month window that you can pick up a disability plan. All right, through any state with a Medigap plan, disability plan. You can also pick up a Medicare Advantage plan if you want. But now you're turning 65. You have another 6-month window at age 65 while you're on disability, in order to pick up another Medigap policy. Okay, again, no questions asked. You can get that plan. Okay, generally the disabilities Medigap plans are a little more expensive than the regular plans at age 65 or older. Okay, so they give you a 6-month window once you turn 65 with your disability in order to pick up a plan. All right, folks. Now, if something happens and you cannot pick up a plan or whatever it is, and you do have a safeguard, let's say you missed that 6-month window, okay? So let's go, for instance, let's follow this. It's called guaranteed issue. Guaranteed issue allows you, it gives you a safeguard in order for you to pick up plans without any hassles. Now, if you had original Medicare, let's say, you were an employer group or health plan, and including the COBRA, or some sort of union coverage that paid, that paid most of your Medicare, so you didn't have to worry about getting any kind of Medigap or Advantage plan, and that all of a sudden that plan ends, well, they give you a 63-day window in order for you to pick up coverage. The only thing it's going to be a guaranteed issue. If you were eligible for Medicare prior to January 1st of this year, your guaranteed issue plan is going to be the Plan F. So you're going to have to pay up for the Plan F. If January 1st of this year and earlier, and later, and you turn 65, your Medicare eligibility, then your guaranteed issue is going to be the Plan G. Okay. So they give you a 63-day window in order for you to pick up a plan, and no questions asked. Let's say another scenario is you are on a Medicare Advantage plan and your plan is leaving Medicare, or it stops giving coverage in the area that you're in, as I mentioned, okay, or you are moving out of that plan's service area. They literally give you 60 days prior to the day of disenrollment and 63 days afterwards for you to pick up a plan. If you don't pick up a plan within the 60 days or the 63 days, then you either, if you want a Medicare Advantage plan, you have to wait for a Medicare open enrollment or annual enrollment now. Or if you think you're healthy enough, you can apply for a Medigap plan, but you do have medical questions that you're going to have to answer. Things like how's your heart rate, your heart, any heart conditions, any lung conditions, diabetes, etc. Okay. Now let's say you go on a trial run. You join a Medicare Advantage plan, and then when you were first eligible for Medicare on your Parts A at the age of 65, and within the first year of joining, you decide you don't want this any longer. You want to go back. You want to do original Medicare. Then again, they give you a 60-day window prior to the day that you're going to disenroll, and 63 days after the day of you disenroll for a guaranteed issue. Let's say you drop the Medigap plan, you think it's too expensive, whatever it is, and you decide to go to a Medicare Advantage plan for the first time, and you have been on the plan less than a year, and you want to go back to original Medicare for whatever reason. Again, 60 days prior to the disenrollment, 63 days afterwards, guaranteed issue. Your Medigap company goes bankrupt, and you lose your coverage, 63-day window in order to get another plan, guaranteed issue. Okay. Again, I only recommend companies that are like the Aetnas, the United Healthcares, Mutual of Omaha, all the big companies that they're not going to go under anytime soon, at least knock on wood. If you leave a Medicare Advantage plan or you drop a Medigap policy because the company has misled you, so they told you this is what's going to happen, or your doctors are covered under this plan, or you're an Advantage plan or whatever, and you've been misled, you can file for guaranteed issue through Social Security, and you have 63-day window in order to pick up coverage. All right, folks. So you do have safeguards. All right. So that's it for Medicare supplement plans and Medicare Advantage plans. Okay. Let's go into that lovely Part D prescription drug coverage. This is the one that confuses everybody. This is the one that, as I mentioned before, if you do not get the right coverage for the first time with your plan, your RX plans or your medications, you can spend thousands of dollars more unnecessarily than you really need to do. Okay. This is the time of year right now, October 15th, December 7th. I keep harping on it, but it's important to check those plans. Even if your medications don't change, you had an existing RX plan, your medications don't change. Guess what? You can get your RX, your meds didn't change, but the plans do. Every plan reweights their individual RX or their medications every single year, and they make changes into those plans. So that plan you had last year, which was great and it worked for you, might not work for you for next year. So it's very critical. As far as every single insurance or every single RX plan that's on the market, as I have mentioned before, they must follow all CMS federal and state regulations. Okay, they cannot charge above a certain deductible. Their initial coverage is going to end after a certain period, which then you're going to fall into the donut hole. and you're going to come out of the donut hole after a certain amount of money also, okay? And then you're going to pay a certain amount during catastrophic coverage, okay? And I'm going to go over those so you guys will understand. And I'm also going to go over a scenario that where you guys will really see what the pricing difference could be. So now, as I said, during the deductible pricing was $435 for 2020. 2021 is going to be $445. It went up by $10. Okay, so the only time that a deductible can only take effect is during as long as your medication is a tier 3 or higher. Tier 3, 4, and 5 medications are the only ones subject to a deductible. Medications tier 1 and tier 2 are not subject to deductible, so you don't have to worry about it. You can get a plan that's got a deductible. You have a tier 1 or tier 2, don't worry about it. You're good, okay? You will be charged the deductible if your medication is, again, a tier 3 or higher, and if it's over $445, you will be charged the deductible. But let's say you have a Medicare, a tier 3 medication, but it's only, let's say $40. You will be charged $40 for that medication until the deductible has been paid. All right, the $445 has been met. Once that has been met, then what happens at that point is that you'll be charged just the copay. So it could be $10, $15, $20, depending on the medication itself. Okay, and again, all insurers reweight their medication differently, and they all charge differently for different meds. I've seen medications for one insurer be a tier 4 or tier 3, and be a tier 1. It's not, through another insurer. The best way to figure out what your plan is going to be is through Medicare.gov. Okay, Medicare.gov. We list all your medications, the dosages, the quantity limits, or your quantities on a monthly basis, and your favorite pharmacy. It takes everything into consideration, and it tells you which plan is going to be the best plan for you, and quite literally is which is the less expensive of the plans. Okay, so it takes the premiums, the monthly premium for that plan. It takes your deductible for that plan. It takes the co-pays for that plan, and as long as you work with your preferred provider pharmacy, once those 4 factors are taken into consideration, whichever plan is the least expensive of all is the one that's going to come out on top, and it's going to say this is the best plan for you according to your medications. It's a very individualized planning for your RX plans. We all take different meds, different dosages, so what might work for somebody is not going to work for the other guy or for the next person. All right, it's very individualized. Now, once we get past the annual deductible, now we go into what's called step 2, which is the initial coverage. At that point in time, all you're going to pay is for either copay or co-insurance. Okay, but once your total retail pricing on all your medications reaches $4,130, it's going to be in 2021. Once your total retail coverage of $4,130, your total retail pricing of your meds reaches $4,130, you fall into what's called the donut hole. Okay, so now you were paying $400 for a medication. You were paying, like, let's say, $20 copay or something like that during the initial coverage, and now all of a sudden you fall into that donut hole. Well, if you can see there, you'll be paying 25% of either a brand or a generic drug. Okay, so now you were paying $20 during the initial coverage. Now you walk in, let's say if you hit it September or October, whenever you hit the donut hole, and that the pharmacist is going to say, okay, well, that medication is going to cost you $100 because now you're paying 25%. It's a $400 medicine. Okay, so you will be getting higher, paying more once you hit the coverage gap or the donut hole. Okay, the real out-of-pocket expense, it's not $4,130. Remember, that's the retail value of all your meds. The real out-of-pocket expense is about $2,000 that you would incur in order to get into the donut hole, and then to get out of the donut hole, it's what's called the troop, or the true out-of-pocket expense. It's not $6,550. Don't get scared. It's about another $2,000 of true out-of-pocket expense. The actual true out-of-pocket expense is whatever you pay for co-insurance, that 25%. The plan will pay an additional percentage. The pharmaceutical company will pay an additional percentage. So all of those 3 factors combined will reach that troop or the $6,550. Okay, Again, it's about $2,000 roughly out of pocket for you in order to get out of the coverage gap and into catastrophic coverage. Once you get in catastrophic coverage, that's the least amount that you're going to pay for anything. You're either going to be paying 5% for that medication, or if it's a brand name drug, it's going to be $9.20, or if it's a generic, you're going to be paying $3.70. So your pricing drastically reduces once you hit catastrophic coverage. About 16% of the people go into the coverage gap. And once you hit the coverage gap or the donut hole, it's maybe about 5 or 6, maybe even less than that. Let's say 5% of the people come out of the donut hole and into catastrophic coverage. Okay. Now let's look at some scenarios of the Part D plans. Okay. This is a gentleman that walked into our office. This was a few years ago, but it's a great example to use because when he came in, he wanted a Medicare supplement plan. And he wanted his buddy's RX plan. Oh, my buddy's RX plan, great plan. He pays $39 a month for that plan. And you know what? It works well for him. He's very, very happy. That's the plan that I want. We're like, okay, let's look at the plans. Mind you, you see that's the number 2 mistake that people make? Okay, it's not analyzing your Medicare, your RX plans correctly. Okay, so what happens? This is the actual list of medications that this gentleman was on. And as you can see, his total monthly cost for all of his medications, retail cost, is $1,669.84. Okay. We told him that this plan, this card A, was the best plan for him. The monthly premium was $98.30. And he's going, no, I want my buddy's $39 plan. Okay. Let me just go over the initial coverage. As you can see there, the initial coverage, what he was going to be paying basically on a monthly basis while he was through the deductible phase was $611. Okay. That's through deductible and the initial coverage. Once he got out of the initial coverage, the initial coverage, and went into the coverage gap or the donut hole, he was going to be paying $781 a month for his medications. And then once he got out of that and went into catastrophic coverage, his bill was going to be $88.78. Okay, so as you can see, the catastrophic is drastically reduced at that point. And we told him that yes, this card is a $98.30 card. Your total annual cost is $4,700 or $4,800. Okay, and you have no deductible on this plan. Okay. He wanted his buddy's $39 plan, so we showed him what his buddy's $39 plan was going to cost him. This is the card B, his buddy's plan. As you can see in the red there were 3 medications that his buddy's particular plan did not cover. So what happens, he would have had to pay full price for those meds for the 12 months that he had the plan. So in essence, he would have been paying $12,800 for this particular plan. Sure, it didn't have a deductible either, but still. He would have been paying, what's that, $6,800, $4,800 versus $12,000, over $6,000 in more for a year. And this is why I had said before, if you don't do your RX plan correctly, you could be spending thousands of dollars more. And then we further showed him that it had nothing to do with the monthly premium on the plan. So we showed him another plan that was $97, which was comparable to the plan that we want him to take. This one had a deductible of $325, but as you can see, there was another medication that it did not cover. So that other medication, once again, he would have been paying for 12 months out of the year, would have been paying full price for that med. So his total cost, that would have been over $16,256, $16,300. That would have been his total cost for the medications. Okay, do you guys see what I mean about this? Generally, when I do this in person, I give this example, but at the same time, I actually take for the current year's plans and I input medications onto it. And then I show you from where the Medicare.gov tells me which is the best premium or the best plan under the least expensive cost. And then I go all the way to the very last plan for the exact same drugs. You can see how much of a drastic difference there is in pricing. And usually I get like, oh my God, so critical is the number 2 is make sure you plan your RX correctly every single year. Again, even if your meds don't change, the plans do. All right, folks. And just to summarize the cards, The card A that we recommended was for $98 plan. He was going to spend $4,800 for total annual cost for him. His card B, his buddy's card, $39 was $12,600 was going to be his cost, and that card C at $97 plan. If he went that route mistakenly, he would have been paying over $16,000 for that plan. Okay, so folks, that concludes my presentation. I just want to go over some of the key points right now. The number one point, remember, it's not enrolling in your Part B on time. Your initial enrollment period is critical. Be careful with that Part B. It's a 10% penalty when you're supposed to enroll and you do not. Don't forget the Cobra trap that we spoke about. Retiree plans. You should look at retiree plans as to what, some retiree plans will require, most retiree plans will require that you get your Medicare A and B. So it's critical to figure that out and find it out. Okay. Social Security disability, 6-month window when you get Social Security, 6-month window when you get that at age 65 in order to pick up a plan. Okay. Not analyzing, the number 2 mistake is not analyzing your prescription drugs. As I showed you the examples, it could cost you thousands of dollars. And by the way, each state has about 30 different plans. Each company has about 3 or 4 different plans that you can choose from. Okay, Medicare.gov it does analyze every single plan within the state, within in the zip code area, the state basically, and it will let you know which is the best plan for you, regardless of which company it is. Okay, the formularies on those plans are key. Each company, as I mentioned before, they do check, they do reweigh, or they do weigh their different medications differently. So it's definitely key. Annual enrollment right now, October 15th to December 7th. If anybody wants, email me, send me your prescription drugs. I will be more than happy to send you an analysis, free analysis of any, the RX plans for now, for coming up for 2021. Not analyzing which coverage you want. Do you want a Medicare Advantage or do you want a Medigap plan? Remember what I said to you. This is the most important choice, because this could possibly be the plan that you're going to carry for the rest of your life. So be very, very cautious as to what you're going to get. Speak to a professional. Find out, dot your I's, cross your T's, figure out exactly what it is. Do you want networks and referrals? What's the maximum amount of pocket expenses? Even if you have your coverage, your employer you have a coverage, retirement plan, and you can keep that plan. Okay, how much are you going to pay for it? Remember, you can get Medicare with a Part B and let's say a Part D, which is the most expensive you're going to pay. It's about $300. Okay, if you're going to spend $500 with a $5,000 deductible, is that worth it? You'd rather spend $300 and $198 deductible. So analyze what you have versus what you can get and see. Okay, the Medigap Advantage plans. Look at the changes during the annual enrollment. See if your plan's still good, or if you might want to change something else. Check the overall expenses as I just mentioned. Okay. Number 4 is not analyzing your retiree coverage. I just mentioned that. What can you get for your premiums versus from your company, your retirement company, versus what you can get from Medicare. Medicare is a great product, folks. It really is a great product. It does have a lot of, like I said, it covers a lot. So it's really a good product. The number 5 mistake that people make on Medicare is listening to friends and family. I like to add TV commercials on that too. It's not what it's cut out to be. Whatever that drug card is for you might not be good for the other guy. Okay, forget about the advertisements. Yeah, they're going to promise you the world. Be leery. Analyze your entire expenses, not just the premiums, as I mentioned before. And be careful with those association plans. They're not guaranteed renewable, so you can get stuck. So now that concludes my my entire presentation. This is my number, my phone number, my email address. Please feel free to take down any information and call me. I do not charge any for consultations. I don't charge for any services. I don't charge any fees whatsoever. I am a broker. I deal with all the major A-rated companies in the United States, and I'm commission-based with them. So I will never charge you a fee, and I will steer you in the right direction. And by the way, I'm not going to steer you to a higher premium because it doesn't work that way. Okay. It's basically the same pricing all the way around, no matter which company. So what I want you to do is if you want to buy a product, you're going to buy a product. I'm going to make my commission that way. So I'm not going to steer you wrong. I'm not going to give you any kind of, it's not going to be a upsell tactic, not at all. Okay. So take my information down, give me a call. And I'm open for questions, and I'm open for, Q&A now if anybody's interested.
All right. Well, it seems like a lot of people were overloaded with information, which is good. It's a lot of like, yay! It's a lot of information in the chat. Let's see. Robin asked a question. She asked, "Why is group coverage through your spouse's employer better than Medicare Original Plus a supplement plan?"
It is and it isn't. Okay, it is and it isn't. You once again, you have to analyze. You can keep your spouse's coverage plan. You can keep that if you want. Okay, if you guys are both under the same plan and you're paying very little for it, then there's no reason to take Medicare A and B. So you can hold on to that group coverage. Remember, if you're not disabled, you have to have 20 employees or more. If it's under 20, you have to go with Medicare. Okay, but no. Evaluate what you have to what Medicare can give you and see which would work for you. And not necessarily Medicare would be the, original Medicare would be the right way to go. No, that's not the way. You have to evaluate it. You should talk to somebody and see which way you can go.
Okay. Next. And then Robin had also asked, is the slide deck available? So like I said in the chat, this presentation is being recorded. So it's going to be available on the Woodbridge Public Library's YouTube channel. So anything that you were confused about or you wanted to take note of, you can pause, rewind, fast forward, all on YouTube. And like Mike was saying, he's available to talk and email anytime that you have the question pop up.
Absolutely. And I'd also like to just mention, if anybody wants a copy of this presentation, I'd be more than happy. Normally, when I do the presentations at the library, I always give everybody a copy of my presentation, and they can take notes and all that on there. If anybody wants a copy of the presentation, email me, and I'll be more than happy to send it to you.
Definitely. And Anita just asked, is Medicare A free at 65?
As long as you've worked for your if you worked in the country and you've paid your Medicare, your Social Security insurance, your Medicare insurance for 10 years or 40 quarters, yes, Medicare Part A is free. If you don't meet that criteria, you can get it, but it could be about $400, $450 a month, for $450, $460 a month, something like that. The Part B is the only one. The Part B as in boy is the only one that you do have that monthly figure. And again, it goes through the IRMA through the modified adjusted gross income. That's how they would figure that out. Yeah, depending on your income.
Okay. Any other questions, guys? Feel free to post them. I don't see anything else. What happens if additional drugs? What happens if addition drugs at later date? I guess
I understand. That's a great question, and I apologize for not mentioning that earlier. Okay, yes, we do. When you go through Medicare.gov, you set up all your medications, and that medication goes on file. Okay, so we're going to make sure that whatever plan you get, all those meds are in there. Now, later on, the doctor puts you on another medication. Okay, what happens? If it's an expensive medication, you're going to go on what's called step therapy. Okay, that step therapy. Well, if it's too expensive, all right, they're going to go with the least expensive medication first. So then they're going to reduce it. They keep going down or keep going up until they find the right medication. But if there is a medication that's not on the formulary, okay, you have a safeguard with that. You can get a formulary exception. Your doctor can file for it, or you can file for it. Better the doctor files for it, but either one of you can file for it. the insurance company will take it into consideration. They might or might not take it, but they will. They'll if they put it in, it's going to go in as a tier 4. So you're going to pay a little bit more for it. You're not going to pay full price for it, but you are going to pay a higher copay, and you will be subject to the deductible at that point. Okay, and then the following year during annual enrollment, we will incorporate that medication into the plan to see which plan does cover that medication at a point. So you do have a safeguard. You can get a formulary exception, and from any medications that come in later on. And for the most part, they do take it. They will incorporate it into your plan. That's a great question. Thank you very much.
And I got another question. Does this apply for SS disability?
Could repeat that one again?
Does this apply for SS disability?
Does what apply for Social Security disability?
I don't know. This came from San. If you want to elaborate, San. No elaboration. Maybe they're typing.
I'm sorry, I'm not really understand that. Does this
I
apply for Social Security disability?
Says the Medicare cost plans. I guess does the Medicare cost plans apply for SS disability? I think that's what they're asking. What I've gathered.
I'm not 100% sure. If you want to email me that question, I will be more than happy to find out for you. I'm not exactly sure what the question is asking. I do apologize for that.
Definitely follow up with an email, Sam.
Yes,
Anita
please.
asks again, if I continue to work with full coverage till 68 to 70 years old, what do I have to do about picking anything?
You will not pick up anything. You do not want your Part A or your Part B. Part A doesn't matter. You're not paying for it anyway. You can get it, but you don't have to pick it up. The critical one not to pick up is that Part B. Okay. The Part B, once you do decide to retire at 68, 70, whatever it is, remember you need those CMS forms that I talked about. That will prevent you from getting the 10% penalty per year that you didn't pick up the Part B when you were eligible at age 65. Okay. So critical, do not pick up A or B at that point. If you're collecting Social Security and they auto enroll you in that A and B, disenroll from the B. Very important to disenroll from the B. Because what happens? If you keep that B and now you decide to retire, you've had that B for over 6 months, and if there's something wrong with you, you will not be able to pick up a Medicare supplement plan. So when you do enroll on the Part B, remember you have that 6-month window, okay, in order to pick up any kind of plan. So it's very important you do not pick up that Part B. If you can keep your coverage if you don't want to, but you should analyze both and see, what's going to be more, better for you, what's going to be less expensive for you, and what are you going to get? What kind of coverage are you going to get versus, with both sides. In other words, compare what your group coverage with your Medicare coverage and see what works out better for you. But yes, you can keep it and get rid of the B. Don't take the B.
And this is, I guess, going to be the final question of the night. Mike asks, Mike, do you have a website?
No, I do not. Sorry. I am the website. Email me, call me. I will be more than happy to help you out with any, in any situation.
Well, I guess one more from Anita. Who is eligible for Medicaid?
For Medicaid? Medicaid is a low-income subsidy. The threshold, it's maybe $17,000. If you're earning, I believe it's $17,000 a year or less, then you'll be eligible for Medicaid. It is not the same as Medicare. Okay, it's a low-income subsidy when you'll be eligible for Medicaid, and that will go as Medicaid and Medicare at the same time.
And on that note, I think that's a good place to end tonight's presentation. Thank you so much, Mike, for coming out and presenting all of this information. I think it was a lot, but I think it was a lot of good information for everyone. And like I said, feel free to go to our YouTube page, which I probably will hopefully post this by tomorrow. I'm going to work on it tonight and hopefully post it either tonight or tomorrow. And I'm probably going to send everyone the link in the same way I emailed you all the Zoom information. And yeah, so thank you again, Michael, for coming out and giving us all of this information. And
Thank you.
no problem.
Thank you guys.
Everybody
You guys
have a good night. Thank you for coming to our coming out and or staying in and watching this presentation tonight.
have a wonderful evening, everybody. Thank you so much.
Yeah.
Take care now. Bye-bye now.
I'll see you guys.